And with the White House officially now declaring a public health emergency, we wanted to look into what this means for addicts and the impact it'll have here in Northeast Ohio.
We were, as a family, we were blindsided by this and devastated.
Monday marked 2 years since Greg McNeil lost his son Sam to a heroin overdose.
Sam had every reason to live long term. He had so many things going for him. And he was such a fun and talented guy. He was a great athlete.
It's a crisis that claims more than 140 lives every day in the United States, with Northeast Ohio at the epicenter.
It's really sad that it's gotten this far prior to at the highest levels, ringing alarm bells.
The Obama administration has been criticized for not acknowledging the crisis sooner. In fact, President Obama's health secretary, Kathleen Sebelius, says they didn't do enough, and recognizing the issue earlier could have prevented many overdose deaths. After taking office, President Trump appointed a commission to study the epidemic, which called on him to declare a national emergency. The president referred to it as a national emergency in August, but stopped short of officially declaring it as such Thursday.
It doesn't include additional funding than what is already in the budget, but it does put the emphasis on this so that grant monies can move towards the crisis a little faster than what they normally would.
McNeil has devoted his life to education and advocacy, founding Cover 2 resources in his son's honor. He says it's about time for the government to finally step up, but he has concerns.
It's a 90-day order. So this isn't a 90-day problem. This is a long-term problem. And hopefully the thought behind that is, well, okay, let's get started, see how it goes. And if we need to shift in short order to a national emergency in the Stafford Act, that's what we do.
At the end of the day, McNeil says the real difference makers are people in the community. He says we all have to be a part of the solution, but this is a step in the right direction.
If we're properly funded and properly led, I believe that can make a tremendous difference.
All right, now in terms of the impact the declaration will have, a lot does remain unknown. President Trump still has to name the key players who will carry it out, including a drug czar and Secretary of Health and Human Services.